This video about surprising link between accelerated aging and baldness. So let's talk about this interesting subject, and as always, you can download my presentation from the link in the description as PDF file. And I was talking about this hair loss in three my previous videos, and I'm coming again. Why I'm coming? Because I want to go deeper, and also I have some ideas and hypotheses to explain why it is happening, and also the way how to return the hair growing, and improve your health also. Okay, let's go. Hair aging, terminal hair loss, or so-called androgenetic alopecia, and regrowth of hair have been subject of discussions in my videos. This you can click, you can download the presentation and then click on these links, and you get to the videos. And you can find the link to the presentation of these videos as PDF files in the video description. Due to significant interest in this topic, I'd like to provide further information and present my tentative explanation of why some men experience hair loss and what can be done about it. My hypothesis suggests that male pattern androgenetic alopecia occurs due to chronic hypoxia in the scalp, leading to oxidative stress, inflammation, accumulation of senescent cells, collagen deposition near hair follicles, loss of scalp skin elasticity, and eventually fibrosis. This fibrosis restricts hair follicle growth depth, leading to hair follicle miniaturization and male pattern baldness. Okay, this is quite interesting subject, and many people try to grow hair because they're losing hair, sometimes in young age, and there is, as I said, a surprising link between accelerated aging and baldness. As I'm not a medical professional, but scientist with PhD in physics and mathematics, at least I can think logically. And a big part of my professional skills is to read scientific publications, develop an idea that may explain a phenomenon, and find experimental confirmation of the idea. If there is no experimental or observational confirmation of my idea, another hypothesis has to be proposed, etc., and to find the truth in steps. It looks like medical professionals don't have time to read scientific publications and do deep research. Also, clinical trials to verify the ideas are very expensive. It explains that instead of holistic approach to health complications and aging, medical professionals choose so-called evidence-based medicine without a clear understanding of the underlying mechanism of health complications. So again, also we have to mind that medical care is business. It is not science. Why medical professionals don't read scientific publications? Because they are interested in business, making business, and making business includes making people sick and addicted to some procedures, expensive procedures and expensive medications. So this is a state of what is happening. And my video is about how you can get your hair growth and how you can slow down aging without medications. So last 20, maybe 25 years, I never used help of medical professionals, and I'm not going because I'm not sick. I stay healthy, and if there are some problems, I just find what is the root cause, and then I resolve the problem. So, why it is like this alopecia was? What is the idea of medical professionals were? Research has shown that castration halts the development of balding, of this main pattern pardon, I cannot just remember. So androgenic alopecia, androgenic, you see again, androgenic, it is like related to androgenic hormones, and it's in particular testosterone. And it's again, in the name of the problem already something wrong, okay? So again, research has shown that castration halts the development of balding unless testosterone treatment is administered. So the idea of these professionals was, okay, if testosterone administered and then you have continuation of the balding, okay, then it is problem with testosterone, so too much testosterone. And additionally, estrogen injections in castrates have shown significant hair recovery beyond what is expected. It's again so discovery, they got a solution probably, but it is not, Okay, despite the common belief among the medical professionals that balding is influenced by high androgen levels, so testosterone, and particularly dihydrotestosterone, which is an active derivative of testosterone, which is absolutely important for any man to have this active hormone. So, and it is again, but again, my opinion, it is not the root cause of balding. It is based on observations, but all the observations are not causative, but just correlated with the problem. Okay, it is not the root cause of balding, in my opinion. Again, I think logically. I read the scientific publications and compare facts, and I'm coming to different explanation, which to me seems to be more logical. First, okay, studies have found that 37% of the sufferers of this balding exhibit significant inflammation and fibrosis around thinning hair follicles. So fibrosis, how it is develops. Okay, we know what is the reason of this fibrosis. Balding areas also show a near fourfold increase in the deposition of collagen fibers. Yeah, okay, this is fibrosis, the development of the fibrosis. Interestingly, hair loss is mostly isolated to specific scalp regions with thinner and stiff skin, while the growth of secondary body and facial hair in men is accelerated by higher level of DHT. So it is, you see some strange fact that high level of DHT improves growth of the secondary body and facial hair in men, but why it is not to the scalp? Okay, there is explanation. So this it was long known that the castrates they have quite special body type and they have very good hair on the scalp. But how can I explain it? Okay, I will go to explanation in my longer video. This is relatively short. And this Vice President Trump, you know, he's suffering from hair loss, and he decided to use this therapy, which reduces the level of this testosterone. And what he is getting body of such people, of these castrates. He is chemically castrated. Yeah, I cannot understand him, but it is like he is a rich person, but cannot afford correct medical services. Yeah, so again, maybe he will pay me and I will help him. Yeah, poor man. In my opinion, the stiffening of blood vessels due to the destruction of elastin fibers, the replacement of elastin by collagen, the cross-linking of collagen fibers with sugar molecules, and the calcification of blood vessels are among the root causes of aging. So this, my idea, this my model of aging. Of course, there are some other causes of aging, like accumulation of some toxins and oxalates in your body, but okay, this is what's happening normally in people who stay on so-called balanced or standard diet. Hypoxia has been detected in frontal scalp regions of men suffering hair loss, and balding scalp sites have been found to have 40% lower oxygen level in blood compared to not balding sites. Okay, you see clear indication that these balding sites, they are in the state of hypoxia, not enough oxygen. Okay, and autopsy finding suggests that stiffening and calcification of capillaries supplying oxygen and nutrients to hair follicles may contribute to the progression of balding. Okay, this is how stiffening of blood vessels develop, it is eventually get to calcification, and we see that this is what is happening. In the hair transplantation procedure, a hair follicle is used with surrounding tissue without fibrosis. So it is again, if we put the hair follicle inside this damaged area with fibrosis, but this hair follicle has some tissue around it, and which is elastic without fibrosis. So the transplanted hair follicle may grow deeper, at least for a year or longer, and get more nutrients from the blood capillaries in the scalp. Of course, it will not work forever, but at least for a while, it helps. It helps. What is happening? This is about artery, how this calcification develops in to get pictures of the calcified of this capillaries with calcified walls. I didn't find it, but okay, this is what is happening. So you see this calcium salts here or here. So it is again what is happening. The vessels get stiff, and the cross section of the blood vessels is dropping. So they cannot supply enough blood, enough nutrients and oxygen. So these facts, again, prove my hypothesis that balding is related to development of chronic hypoxia and the development of fibrosis in the scalp. So again, reasons of aging and balding are related. This is easy. Okay, we are aging because of this, and we are losing hair because of these consequences. Chronic hypoxia, compromised blood flow, this is the root cause. To resolve this health complication, we have to improve elasticity of blood vessels and blood flow in the scalp. Okay, so locally in scalp, but also in all the body. Studies have shown that regular long-term endurance or so-called aerobic exercise can improve vascular elasticity and the bioavailability of nitric oxide, which helps to improve blood flow, reduce stiffness of blood vessels, and grow new blood capillaries. Okay, this is easy, cheap. You can go every day for 2 hours of aerobic exercise, and then you will see that your elasticity of blood vessels improving. And how to measure it? You measure pulse pressure, you measure heartbeat rate, and you see that your vessels are improving, and not only arteries but also capillaries, and you will see it. And I see it, and my hair started to grow much better when I use these procedures to improve elasticity of blood vessels. Okay, studies have shown that regular, long-term, 2 hours a day, endurance exercise can improve vascular elasticity and bioavailability of nitric oxide, which helps to improve blood flow, reduce stiffness of blood vessels, and grow new blood capillaries. Okay, this, you see how it works. Again, I give in the longer version of this video explanation what we can do and to improve this elasticity, and okay, but it is a part of the procedure of rejuvenation. Okay, in contrast, resistance exercise may contribute to arterial stiffness. Okay, you see difference. Aerobic exercise, they improve your health, they reverse your aging, you can reverse your losing of hair, but resistance exercise not, especially if you will use some hormones, hormone replacement therapy with testosterone. You are done. Okay, there are explanations why resistance exercises are not good in old age, and many bodybuilders who go to resistance exercise, they die young. Some 30 years age, and maybe maximum 50 years age. So you just think what to do. And I was explaining in some previous videos what we can do to grow muscles and together with reversing of aging. Overall, a holistic approach to improving vascular function and blood flow can be implemented to slow down the development of balding and aging also, which may include lifestyle changes such as regular aerobic exercise, long-term aerobic exercise, a ketogenic diet. Why? Because the stiffening is related to glucose in blood. Vitamin C and the lysine supplementation. It is the so-called protocol of Linus Pauling protocol. I find it very interesting and very helpful. Okay, it is not accepted by medical professionals, but okay, it works. I believe it works. Topical treatments with minoxidil. Okay, this can work, but not for all people. If you have already fibrosis, it will not help. But in young age, it can help. It's like 30% of men in young age, an age of from 20 to 40, they see improvements. Okay. So what else? Mesotherapy. It is, again, I will explain what it is, and it can help. It can help, but again, it is better to start from exercises. And again, hair transplant surgery. Okay, I explained what I explained in previous video how the hair grow. You see, they need blood capillaries to supply nutrients to grow in hair to these cells. But again, it is anagen phase, it is growing of hair, and then it is going to catagen phase. It is when the hair separates from blood vessels and go up, and eventually it is losing. Telogen phase hair is lost here. But when it is lost, these cells start to grow deeper. And you see this fat. This is adipose tissue. It is relatively soft. So it explains why these castrates, they grow hair, because the thickness of the skin on the scalp is getting thicker, and also it is softer and not so stiff, and then this follicle can grow, and then okay, this is also again a little bit better. So you see that what is happening. The telogen phase, all the cells and everything go up, and eventually the hair get lost, and then these cells have to grow deeper to almost how it is shown, almost to the adipose tissue. Okay, and here it is not very well shown, but this is true. Okay, it has to go deeper to blood capillaries. There is some connection between psoriasis and baldness. Okay, there is some connection, even if you don't have the psoriasis, but it is like contributes. It contributes. Your guts, the health of your guts contributes to baldness, even if you don't have this very severe complications. Your gut health contributes to losing of your hair and to accelerated aging. You have to take care, and I will go in more details in a video which will be available in that Saturday. Okay, so you see that again. Please mind that again, I am not medical professional. Don't be like President Trump. It's crazy. It's crazy to be like to grow hair, but to have such a shape of body shape, it's and of course it's crazy. He's a rich person. He can pay money. Okay, pay me money. I will help. But okay, whatever. So and because medicine, even for rich people, medicine is business to suck more money from the people, making him sick. And then to provide some little bit, not solution, but because medicine need customers. To have customers, you have to make people sick, and sick people will pay if they suffer from hair loss or from aging. Yeah, then they will pay any money. Okay, any money. And hair transplantation, as I said, it works at least for a year. It works. But then if you don't do all these recommended steps, then it will not help too long. For a year or two, maybe it is okay, but then it is okay. So you see, accelerated aging and hair loss are related. if you are getting balding, if you are losing hair, it is indication that you will not live long. You have to do something with your health. And okay, just follow my channel, watch my videos, and I will give you good advice on what to do. Okay, thank you for your time. Download the presentation or watch my long video, which will be available this week, Saturday. Okay, ciao, ciao. Have a good day.